I have a friend with muscular dystrophy who used to say, we were the population who was hoped for, and now we're here. And he's an adult who's friends with some of these guys. And I think that's a really great way to frame this panel, because we've been talking about a lot of themes that a lot of these men talk about and have been talking about in the last couple days as a part of our leadership workshops that we've been doing with some of the men who've been here for the last few days with us. And so we thought that this was the important voice to end our meeting on, was our adult voice. And so you see that we have actually 5 people listed as panelists today. The first person whose testimony I'm going to actually read is Colin Wrench. So if we can pull up Colin's slide. Colin was actually not able to join us because he was scheduled to fly here on Friday, and he was flying from Michigan. And for a lot of the men in our community who use power wheelchairs and who are non-ambulatory, they really prefer and need to fly through direct flights. And many of you know that on Friday, we had a bit of a windstorm coming through the East Coast and some weather. And so his flight was canceled, and there were no other direct flights from where he lived coming to Washington in time for him to make it to this meeting. So he's participating in the stream, and Colin, I hope I do you proud, but he's asked that I read his testimony for him so that we can make sure that his experience is included in this meeting. So, hello everyone. My name is Colin Wrench. I'm now a 24-year-old and living with Duchenne. I'm a graduate student in musicology at Western Michigan University, and am finishing up my thesis on the subject of jazz in Vienna during World War II. I've also recently applied to doctoral programs in musicology and history, as my goal is to become a professor. I currently live with my parents, Janice and Robert, and my brother Henry in Kalamazoo, Michigan, the southwestern part of the Mitten. Being jazz lovers, we also have a wonderful dog, Oscar, named after the famous jazz pianist, Oscar Peterson. To live with Duchenne means that I'm constantly adapting to changing physical norms. If I'm suddenly unable to complete a function that had previously presented no challenge, I have to either develop a workaround or ask someone for that extra bit of help. To live with Duchenne also means advocating for myself by helping others help me. If I want to go to a movie with my friends, for example, I have to teach my friends how to operate my side entry van. On a good day, my personal care assistant shows up on time, and my ride service also picks me up on time. These 2 things help me maintain my rigorous schedule of academic work and engage in social activities while preventing my family members from spending all of their spare time helping me. They already sacrifice so much for me. On a bad day, my personal care assistant shows up late, preventing me from getting out of bed until he arrives. On top of that, my ride service cancels my ride to campus less than an hour beforehand due to inclement weather. In this case, I have to ask my mother to drive me to campus, forcing her to cancel her plans. The symptoms of Duchenne that have the most significant impact on my daily life are extremity weakness, limited fine motor skills, and neck weakness. My extremity weakness makes it difficult to eat, turn myself in bed, and generally adjust my body position. As a pianist and percussionist, my limited fine motor skills make it very difficult for me to play piano and have made drumming nearly impossible. My neck weakness, partly a symptom of Duchenne and partly a result of my fused spine, prevent me from sitting comfortably without a head support. None of these things prevent me from engaging in advocacy and things that I love, and I've been proud to participate very actively in this community. Thank you. Okay, I think next we'll move to Ben. No, those aren't those. Ben Dupree.
Hi, I'm Ben Dupree. I was 9 when I was diagnosed with Duchenne muscular dystrophy. I'm now 25 years old with a bachelor's degree in biochemistry. I'm here with my mother, and I have a sister who is 22 years old and pursuing a degree in journalism at the University of Missouri. For many years, I struggled with depression, which was partly due to feelings of isolation and inability as a result of living with DMD. I have since worked to develop a support system to keep myself emotionally balanced, since that makes it much easier for me to keep up with the multitude of daily care tasks that come with managing a diagnosis of DMD. Much of the work I've done while learning to manage my depression is focused on becoming more flexible when considering how my symptoms and care needs fit into my daily life and future endeavors. This has been invaluable as I have begun to consider options for graduate education. When looking at different schools, I have to think about how I will maintain access to routine monitoring of my cardiac symptoms. That way, I am prepared in case of a rapid decline in the condition of my heart. I have to think about how to find personal care attendants who can work with me during the course of the program so that I can continue therapies that prevent pain and preserve my bone health. I have to think ahead by making sure there is a doctor in my area who is aware of my medical needs and keep a cough assist machine around in case I get sick and am not able to clear the mucus in my lungs. On the best days, I have no pain, I'm not sick, and the condition of my heart is stable. But I need to remain prepared for the worst days, the days where I'm so sick that I can barely move, when my back and legs are in pain, or when I've lost a function I used to have.
Thank you, Ben. All right, Jonathan.
Hi, my name is Jonathan Santino. I'm 24 years old. I've been a member of the PPMD Adult Advisory Committee for a year now, and I have Duchenne's muscular dystrophy. So what's it like to have Duchenne's muscular dystrophy? Well, it's a degenerative neuromuscular syndrome where the patient lacks the specific protein dystrophin, the protein that binds muscle tissue together. To treat it, patients must take great care to maintain their cardiac and pulmonary function through mechanical therapies such as BiPAP and cough assist therapies, in addition to standard medication. Use of corticosteroids and daily regimen of stretching and exercise to maintain mobility and reduce muscle wasting is also in play. As diagnosis suggests, the patient's prognosis is constantly changing, and therefore we must adapt appropriately through adjusting our treatment options and looking into new emerging treatments to keep up with our rapidly changing bodies. But is this brief description sufficient for the original question? Unfortunately, it's not. The question still stands. What's it like to have muscular dystrophy? It's more than a navigation of medical care that may or may not be available. Put simply, it's meticulously planning and choosing your time day by day. My days are planned out in advance. My mom and I are constantly asking questions. When will the aide arrive to wake me up? Are there appointments that I have to fulfill? What is the aide's schedule like, and how much time in the day can they devote to my activities of daily living? I not only have to schedule around my needs, but also have to schedule activities around the aide's availability as well. I've mentioned my mother earlier because I still live with my parents. However, my mom works full-time, and my dad's physical condition prevent both of them from providing 24/7 care. Ergo, I must defer daily functions such as eating, toileting, and going out of the house to a third party. But if that party does not show up for their sessions, then my mom can only devote about an hour per day to my care. My house is not completely built for my condition either. While we've modified the bathroom for handicap use, installed the ceiling lift, and added additional square space to the first floor of my house, my condition still prevents full autonomy. I can't independently urinate. There are items that I cannot reach on my own, and if I need something immediately, I must wait for someone to become available to do it. Because of these conditions, I'm unable to live independently. For a 24-year-old man who must be treated like a newborn in terms of basic necessities, it's grating on one's self-image. As of now, I've been a college graduate for a year and a half. While I haven't been able to procure a job yet, I currently occupy my time as a local zoo volunteer. I went to Nazareth College for 5 years and obtained a bachelor's degree in biology with 2 minors in toxicology and chemistry. However, because of the services I require in order to be independent, I can't at this time consider graduate studies. As such, volunteering at the zoo allows me to practice my knowledge in biology as well as communicate with patrons the importance of biological study and conservation programs. In fact, I'm only able to do this because of how my aid service has finally been consistent enough for me to schedule my hours at the zoo accordingly. That's because it's due in part to New York State contractual laws and incorrect modifications. My van is modified for power chair transport and assisted driving, but I myself cannot drive the vehicle as it is considered unsafe. Thus, I have to rely on my aides to take me to appointments and volunteering. So today, I and my fellow PAC members are here to discuss the impact of Duchenne's and Becker's muscular dystrophy, a chronic disease originally only defined as a pediatric condition as it shifts into an adult patient condition.
Thank you, John. All right, Colin?
Hello, my name is Collin Werth, and I just turned 23 a couple weeks ago. I live in Farmville, Virginia, with my parents and 15-year-old sister. I graduated from high school in 2013 and continued my studies in community college, earning an associate's degree in IT in 2015. For over 2 years now, I've been working part-time from home, doing IT contract work, mostly web design, for a small local marketing firm. This is my third year on the PPMD Adult Advisory Committee, and I've enjoyed working with and getting to know other young adults like me while helping to shape PPMD's policy efforts. Living with Duchenne certainly makes things harder for me. I need more sleep than the average person and have to use a BiPAP to help me sleep. My mother is my full-time caregiver and helps me with everything from showering, toileting, and getting dressed. I have to take many medications each day, including Emflaza, heart medications, and supplements to treat and slow the progression of Duchenne. My family and I travel out of state in order to ensure that my medical care is provided by Duchenne experts, and I thankfully have no serious heart or lung issues currently. However, I have noticed my arm strength start to decline a bit in the past couple of years. For example, I need help washing my back and underarms when showering, and it's getting harder for me to brush my teeth. However, despite all of the burdens of living with Duchenne, I still live life to the fullest and don't let it stop me from following my dreams. Since I was diagnosed 20 years ago, the Duchenne community has come a long way. It is amazing how many drug trials are currently underway and other therapies that are coming down the pipeline. Unfortunately, due to my age and the progression of my condition, I'm still waiting for drug trials that will accept non-ambulatory individuals with Duchenne. I understand there is currently a lack of convincing outcome measures for older Duchenne patients, but having to wait longer for access to these possibly beneficial drugs is hard on me. I'm doing my best to manage the effects of Duchenne currently, but keeping stable or even gaining a bit of strength from a new drug means a lot living with a degenerative disease. Thank you.
Thank you, Colin. All right, Mario?
Great. Thank you, Annie. Good afternoon, everyone. Thank you for being here today. And my thanks to Pat, Annie, and Brian for inviting me to be here. So my name is Mario Damiani, and I'm here to talk to you about living with a chronic progressive disease that is often hard to live with and has a negative impact on my life, being a fan of the Washington Redskins. No, wrong speech, sorry. No, in all seriousness, I'm privileged to have the opportunity to speak to you today. I'm a 40-year-old man, husband, father, son, brother, uncle, homeowner, attorney, who is blessed to have a loving family and large group of friends. I am a community member of the NIH Combined Neurosciences Institutional Review Board. I'm an independent consultant on disability and civil rights issues as well. So I wrote out my testimony and I asked Annie if it would be okay to add a few other things to that. So I'm going to walk you through where my life has taken me, going back, let's say, about 12 years. Many people share the dream of wanting to get married when they get older, and I had that dream, and now I'm actually married to my second wife. So not only can it be done once, it can be done twice. So there's hope, guys. There's hope. But I'm very fortunate that I met my loving wife, Teresa, back in 2010. We got married in 2012, and last September we welcomed our baby daughter, Petra, who you see in the pictures there. And for us, we met and fell in love, and so many good memories as a couple together. But there was a lot of discussion about this parenthood thing. Are we ready for this when I have so many needs of my own? Am I personally ready for this? Not knowing how many years I will be here, not knowing my abilities over time. What will happen to me? Will I be able to be a good father? Those were conversations that we had. Obviously, you know what the answer is. There she is in the picture. So, but it was definitely something where there was a lot of debate internally as a couple. Is this something we could do together? And would I be a good father? Can I change my daughter's diaper? No. Can I pick her up and rock her to sleep? No. Can I feed her a bottle? Arguably. But there's certain things that I can't do as a dad, but there are many other things I can do, and be there for her emotionally as she grows up, be a good influence on her, teach her the right lessons, teach her how to be a good person. Those are all things that I expect to be able to do for her, and so that's something really important to me and my wife, that we're able to give her all of life's lessons that we can during the time both of us have with her. Part of the conversation about having a child also surrounded the fact that we knew that if we had a boy, the boy would not have muscular dystrophy, not being able to pass it on through my Y chromosome, but that a girl would definitely be a carrier. So that was another long discussion back and forth. We opted to try IVF with pre-genetic testing, PGD, that would enable us to try to determine the gender of the child that we would want to have. Unfortunately, after $16,000 and a lot of hormone treatments for my wife, we resulted in only having one male embryo, but it had another genetic defect that rendered implanting it impossible. So then we had another debate, discussion, not contentious, just thinking about the big scheme of things. What do we do now? Do we spend another $16,000 trying again for something that's not guaranteed? Or do we have at it and have a child, and if we get a boy, great. If we get a girl, great. And we have a girl, and we know she's a carrier, and our hope is that in 20 years and 25 years, when she wants to start a family of her own, if she does, that we will support her, and that Duchenne and Becker may not be something she has to worry about. That's definitely our hope. So going back to day to day and what it's like being a dad to a 5-month-old baby girl, it's tiring, as I'm sure all of you understand. It's very rewarding. Every day brings something new. And when I go to bed at night, I look forward to the next day. What crazy fun things is she going to do tomorrow? And so I go to sleep, and when I get up, I'm very anxious to see her. I want to know everything about her and how she's doing and how her night went. But I can't just hop out of bed, walk over to the nursery and pick her up and see all those things. There are a few things I have to do first. So my aide will enter my bedroom. She'll remove the ventilator mask. She'll turn the machine off. She'll take away all the pillows that I use at night to support my back, arms, and legs. She'll conduct a brief stretching routine to loosen up my tight muscles. She'll sit me up in bed, give me my water bottle and hold it while I take a sip. Transfer me to a shower wheelchair, being careful not to bump the area of my chest where my implanted defibrillator is located. That hurts when someone hits that. She rolls me into the bathroom. I go to the bathroom. She rolls me into the shower. She washes my face. She washes my hair. She washes my body. Occasionally, like today, she helps me shave, dries me off, rolls me back to my bedroom, transfers me onto my bed, uses a massager on my hip and leg muscles, applies some medicated skin creams, dresses me, gets me out of my wheelchair, puts on my deodorant and a t-shirt, puts on a sweater, puts lotion on my face, puts gel in my hair. I'm Italian, so I'm very demanding with the hair thing. Okay? It goes with the territory. She prepares my breakfast, and then with my breakfast I take my cornucopia of heart medications, so Entresto, metoprolol, digoxin, furosemide, all part of my daily regimen. Then I use my cough assist to get up any secretions that might be there, and a suction machine. And after all that's said and done, after I've eaten my breakfast, then it's baby time, and I get to visit my daughter, give her a kiss, say good morning, and it's sorry, but it's a tremendous feeling when she smiles back and knows that Daddy's there.
So we were the community that was hoped for, and now we're here. So we're going to do polling, and this is polling that we're referring to adulthood. So this is polling for parents who have children or adults who are 18 and over, and then we have adults in the room who we want to participate in this and who are participating in the stream. And then after Ryan conducts the polling, we're going to move into discussion of that segment of our community. All right, so Ryan?
Great. Okay, wonderful. So some of these are going to look familiar. We were able to structure the responses, obviously based upon the different stages and ages. And I just wanted to also point out that with the help of the PAC and other members of the community board, we were able to put these activities of daily living within their own words, which is really important. So you're choosing the top three biggest impact on a person, symptoms specifically, and we're seeing them starting to come in. Okay. Just give it a minute. So we're seeing the problems lifting arms with above head, rather.
Ryan, can you read the question?
Sure. The adults with Duchenne Becker, 18 and up, or parents of adults with Duchenne Becker, which symptoms have the biggest impact on the person with Duchenne Becker's day-to-day life? Choose 3 from the list. And the options are unable to walk alone, problems lifting arms above head, problems using hands, fatigue, feeling tired, breathing problems, pain, scoliosis, fractures, unhealthy weight, or digestive issues. And it looks like the top 3 choices here are problems lifting arms above head, problems using hands, and unable to walk alone. So let's have the next question, please. Okay, the next question, adults with Duchenne Becker, 18 and up, or parents of adults with Duchenne Becker. If a new treatment could help, which activities would be most important to preserve or maintain right now? So the options are reposition self at night, option A, shift position while seated, option B, bring your hands to your mouth, option C, use a cell phone or controller, it's option D, lift object to read, book or tablet, and that's E, stabilize self on toilet chair, it's F, lean forward and sit back, G, use a portable urinal, H, bear own weight during transfer, I, and then pour from a soda can, J. So I know folks online are still making choices, but from what we're seeing, reposition self at night is the one of the higher ones, along with bring your hands to your mouth, followed closely by use a cell phone or controller. And then not far from behind this is bear own weight during transfer as the 4th. Okay. And the last question in this list, please. Okay. Adults with Duchenne Becker 18 and up, or parents, caregivers of adults with Duchenne Becker, if a new treatment could help, which would be most important right now? And these are more global health measures, as you've seen in other questions we've posed. So you want to choose 3 from this list: more energy, better mood, improved mental health, poor attention or focus, better sleep, keeping a healthy weight,
Yep.
stronger heart, stronger breathing.
It's not.
The internet link isn't changing, I'm being told.
It's still showing the last question.
Yeah.
That one's not my fault. Is there a way to, should we refresh that one?
I've refreshed it like 3.
We've gone all day without technical
Oh, here we go.
difficulties.
No, it changed.
It's changed? Okay. So hopefully you have this question up. I'll give it just another minute. Again, if a new treatment could help, which would be most important right now? And these are global health measures. Okay. So they're still trickling in. It looks like stronger heart, stronger breathing, stronger bones are by far the choices that are receiving the most votes. And we've actually seen this in some of our preference work as well. So, okay. So I believe that closes out the polling for the conference. We thank you all for participating in the live polling, and we're going to be producing a report that will analyze the data and include other things. So we're excited to put that out there. So we thank you all. And here's Annie to do the rest of the panel.
All right. Thank you, Ryan. Okay, so let's move into the discussion. So let's remember, this discussion is focused on this stage of the Duchenne journey. So we're looking at late teens, adulthood, 18 and up, after high school age, primarily. So this discussion is for parents, caregivers, and then our teens and adults who are in the room and participating. And so let's talk about, many of you spent some detail talking about how Duchenne, in a detailed way, impacts you on your best and worst days. But if there's something that you didn't mention or you want to give a little more detail about that and the impact, we've heard a lot today about the impact of having good caregivers. And so we want to spend a little more time about how important that is and how and in the community, we hear a lot of people talk about how everything's dependent on everything, right? That you really plan and strategize in advance. And so if maybe the panelists, and then I know we have some of our men in the back also, and so Ryan, if you maybe want to station yourself around there, and I'm saying that so that maybe Austin and Michael know we're going to be looking to you maybe for some participation here. But if you might want to spend a little bit of time talking about what does a best day, what does a worst day look like, and then for the caregivers also from your perspective, maybe talk about that for a minute or two. So whoever wants to start, we can start up here. Start in the back.
I don't,
Go
do
ahead.
you want to go first here?
I had or Christine.
Oh.
We're starting with a mom.
On the panel or me?
Well, I'll have you do it because you're right there and holding a mic.
Come on.
Thanks, kid. All right, I'm Christine Santino. As you can tell, I'm his mother. We're from Rochester, New York. I think, as John said in his presentation, I work full-time and I work for a global bank. One of the critical decisions that had to be made when Jonathan stopped walking and needed much more extensive support and care was, I looked at my boss and I said, we have a critical decision to make. I either resign from work and become a full-time caregiver for my son, or you allow me to work from home full-time.
Mind you, I make a pretty decent salary, and I carry all the benefits. So when I said to my husband, I posed that question to my boss, and my husband was like, "What? You're gonna quit work? We have no benefits." So, luckily, the company I work for is very gracious, and I work from home, full-time, and that was great till I could get the care in place. It took me about a year to get the mechanisms through New York State in place.
Okay.
Now, as Jonathan said, if someone doesn't show up, he either has to wait for me to get off a phone call to get him out of bed and start his day, and that could be anywhere between 9 and 1 in the afternoon if I've got a really full day. And earlier, Pat mentioned dynamics of the marriage as you get involved in the disease. You know, my husband doesn't like me right now, I don't think.
Okay, let's anchor this though from the vantage point of the guys.
Okay.
Like what would they know about? I mean, maybe he knows about that.
Right.
But just
Jonathan knows
their
about
vantage
that,
point.
and it makes it difficult sometimes at home.
Okay.
Because my husband
Fair.
used to do a lot of the care. He is now backed off.
Okay.
And that care has fallen to me. So,
All right, so we hear caregiver dynamics and impact on employment for
Right.
caregivers. Okay. For some of the guys in the room, Mario, do you want to speak to
Sure.
this? Just some detail around a best day,
Yes.
and then how the wheels can come off that cart, what
Right.
that looks like.
Right. So I think for me, again, being a new dad, there's a lot that goes into that. So the best day is where thinking about muscular dystrophy isn't really part of the equation. I mean, it's there, but what about how's the baby doing? And does the baby if the baby has a fever, what are we doing about that? Pediatrician appointments, anything related to the baby, because that's now what I feel to be my purpose and my focus. And so that really is the best day, I would say. On the other hand of the spectrum, there are times when there may be a situation where I get sick, I have to go to the doctor. Well, if we don't have any other childcare and I can't drive, so my wife has to drive me, what does that mean? It means we're taking our daughter into whatever clinic I'm going to for my care, because we don't have any other option at that point. It's not something we like to do, but it's something you worry about. I mean, this last flu season, all the kids getting sick, I was really worried about that. But there are other demands that come into your life, and it's just something that I guess has worried me. And I think on a broader spectrum, being a dad has really made me think about how long will I be here? I'm already 40 years old, and yes, I have Becker, and yes, I have hope for additional years, but I really, really hope that I will be here long enough for my daughter to remember me. And so I literally have sat down and calculated how many years realistically will I be there when she starts high school. That's a big transition. I hope that I will be. I think that I will be based on everything that I know now from my doctors. But who knows? That could change. And so with a view towards the future and what might happen, some of the tough days revolve around thinking about when my heart function gets so bad that I will have to rely on an LVAD or a heart transplant. And those are things that I don't have to worry about right now, but I'm really looking ahead to the future. And the biggest way that I spend my time right now, besides being a dad and a husband and working, is thinking about what heart failure clinics in the United States I can start talking to and developing a relationship with, so that when I need a heart transplant, hopefully in a long time, but let's say it's 10 years, will they do a heart transplant operation on someone who has Becker muscular dystrophy, who's non-ambulatory, who has severely compromised pulmonary strength? And so, as you can imagine, those are scary thoughts to have, but sometimes, no matter how scary it is, we have to put our focus on those issues and plan for the future.
Thank you, Mario. So Ben, in the end of your testimony, you talked a little bit about your planning to go away to grad school. So you're getting ready to make a big transition, and you're going to have to change your plans for your care routine. And I think the very end of your testimony talks about, and so I just have to plan ahead for the worst days. So what does that mean to you? So as you're planning for grad school and you're looking at 2 different potential schools and 2 different potential states, what are you factoring into planning for the worst days? What does that involve?
It involves, I'd say, a lot of thinking hypothetically about what my condition could look like on any given day in a graduate program, like from the coordinating a schedule with an aide to help me so that I can get to class on time, participate in the variety of different projects that would be a part of that, and also trying to consider what health problems could arise and how I would handle those in a way where I could continue with that program. Some of that involves considering how close is this program to someone who understands my condition, or how close is this program to like a hospital or medical center. What is housing look like around that?
Okay, great. I think we're going to switch questions a little bit to something that we talked a little bit about yesterday and that we sort of alluded to in the polling. And so I'm going to ask each of you to answer this, and then maybe some of the men who are in the room be thinking about it too, so you can answer it. So recognizing that minimal change, because you've been talking about minimal losses of function, but let's reverse that a little bit, think about it in the opposite direction, can have a maximal benefit, and that small changes can have a great effect. If you had a magic wand and could change one thing about your physical ability, or maintain one thing, what would that be?
My arms.
And what does that mean?
As in maintain the strength to either get my arms to actually lift, because even though I can't raise my arms above my head, I still have the strength to kind of use a platform such as this table as a care lever and kind of pivot my arm with my elbow, which will allow me to reach different parts of my body. And with one of the newer robotics initiatives that the PPMD helped initiate, I actually have a piece of technology that allowed me to do that, but not just say use a platform to be able to use my arms as effectively as they are now, but be able to raise them independently. There are still issues with that. It's not exactly a magic wand right now, but it's as close as I can get right now. But, hopefully in the near future I may have lost my legs, but I want to have the strength of my arms to essentially be my legs and my arms at the same time.
That's great. Okay.
I would say I agree with what Jonathan was saying, especially being able to, with my arms, being able to lift them to my face. Like recently, I've started to have to use a straw to drink, but I think it would be nice to be able to keep the strength to be able to lift it to my mouth, or even just being able to scratch an itch on my head.
Okay. Mario or Ben?
Yeah, I have to agree. That's definitely something that that's hard for me to do, and I want to be able, whether it's feeding or drinking or scratching an itch. These are all things that are important. I think another issue that goes hand in hand with the upper body functionality is the ability to use a device like a urinal to go to the bathroom, and the fact that I can still do that is a big plus, and not having to worry about catheters yet, because I can still do some of the self-care items myself. So I think preserving that ability is definitely something that's very important to me.
Okay. Ben?
I would agree that I think that preserving the strength of my arms is where I'd want to see benefit the most right now. Like if I could have a magic wand that just stopped the progression in just my arms, that would be what means the most to me at this moment, because I can still use my arms to transfer from the chair seat to another seat, but that's all like dependent on being able to kind of push myself with my arms, and I can still like perform some of I can shower and like use the restroom moderately independently.
Okay, great. Patrick, Austin, Michael, do you guys want to weigh in here? Anyone else in the room I'm missing? Michael?
Can you hold it? Oh. I was going to mention that everyone's talked a lot about, well, I should introduce myself first. So I'm Michael, I'm part of the PAC, and I'm from Boston, and I go to UMass Boston, but I just wanted to mention something about it's not really something that I'm worried about that I've lost, but trying to keep, we really haven't talked a lot about the physical aspects of it, but I think the idea of the heart and lungs, trying to keep them healthy, and trying to keep them from getting worse, so trying to keep my heart and lungs healthy and trying to raise the PFs. If you do the breathing test, try to get the PFC and the number higher to possibly be able to get into some trials. So that's the function with breathing and the heart that I think is another important thing to keep in mind.
Yeah, so let's throw that in for a second. So this group, so they keep referring to the PAC. We have something called the PPMD Adult Advisory Committee. So a lot of the men in this room are a part of that. We had a very interesting conversation with the PAC yesterday where the PAC was discussing sort of on their own about some of the primary outcome measures that we're starting to see as we have industry now expanding into non-ambulatory trials and considering those trials, and that some of the primary endpoints being frequently considered have to do with pulmonary function, so forced vital capacity, et cetera. But then there was a discussion around what do these gentlemen consider to be most meaningful, measures of upper limb function or measures of pulmonary function, and are there even equal trade-offs? And so that was a very interesting discussion, and so I don't know whether any of you want to talk about Patrick? Perfect. And some of these gentlemen have participated in clinical trials, and they had some really interesting perspectives on that.
He'd actually like to answer the other question.
Perfect. That's okay.
So with the magic wand thing, I think for me personally, it would be keeping arm strength as well, because I'd like to keep the ability to drive. And also even something as simple as playing video games or using my computer. It's something I have fun doing, so it's quality of life even for stuff like that.
Okay, great.
I know
Austin?
Austin
Okay.
wanted to make a comment as well.
And that was for the record back there, Patrick Denger from Maine.
Yeah, so I really
And
think...
Austin, can you introduce yourself?
So my name's Austin LeClaire, and I think pulmonary is very important, and also respiratory, because I am currently in an oral interpretation class, and we have to learn how to project our voice, and I've noticed that my lungs can't hold as much air as everyone else, so I can't speak as loud as everyone else. But my teacher has said that I can project my voice very well, but I would like to do it better and be able to last longer, because I also like writing music, but lots of times I have to stop and redo it because I can't hold enough air for the length of the song.
All right, great. So let's segue into available clinical treatments and some decision making around those available clinical treatments and what those considerations have been. And so I'm going to start with who's involved in those decisions. And so we started in the last panel with the parents and the teens and tweens talking about is the shared decision making and how the young people are now becoming a little bit a part of that discussion. And so I want to ask the same question now that we're talking about adults with Duchenne and Becker. And so for you guys, who's really been involved now in decision-making around your care? How much is that still a shared process between you and your parents when you're meeting with your providers? Are you the one scheduling your appointments and navigating the clinical care, or are you doing it still with your parents? Are you relying still on your parents to do that? And we understand these are choppy waters to navigate. So how are you doing that in your families?
I'll just...
And you're a unique experience because you're married, but I'm very interested because your mother's still very involved in your
Yes.
family too.
Yeah. Especially as doting grandma right now.
Yeah.
No, but I think
Yeah.
for me, my experience was that my parents kept me very involved in the healthcare decisions and encouraged me to develop a voice for myself, to be an advocate for myself. We've heard many stories today where you show up somewhere and a medical professional that isn't familiar with the disease, they don't know what to do with you. And I've had that experience countless times. When I was younger, my parents were there too. But they taught me and encouraged me to advocate for myself. And now I'm at a point where at age 40, I'm handling all of my healthcare decisions. My parents aren't involved in my healthcare decisions. Of course, my wife is. We talk about, the best options for the future. But it's something where I think the earlier kids can have a greater share of responsibility. I think that's better in the long run, because there will be times when a parent or a sibling or caregiver is not always going to be with you as you get older and enter adulthood. And it's during those times where you need to be able to have a voice for yourself and understanding all the meds you're on, what you're allergic to, contraindications in terms of anesthesia, all the important issues. How much, your diet and what's bad in terms of sodium intake on your heart, and a whole host of issues. But those are things, the autonomy and independence, I think, helps in the long run to develop that as young as possible.
Yep. Others?
I am kind of with Mario on at where I'm at. Obviously, I'm not married and I don't have a child, and my parents aren't grandparents, but it's gotten to a point where I currently manage my care, and I kind of tell my mom what went on during doctor's appointments, and she'll help me either find those resources or look a little bit more into it, or I'll have my doctor looking a little bit more into it, or I'll find some point of information and then bring that to the next medical appointment. And it's gotten to a point where I've gotten, even after transitioning out from my pediatric doctors into my adult physicians, it's gotten to a point where I've been on good rapport with my doctors. So it'll be, an example would be, I'll go to my primary physician, we'll discuss how I'm feeling, what I've learned in the past few months in regards to my health. Is there any way we can improve on that? And then if she writes up a prescription, I'll essentially go back home, relay all that information to my mom, and then she'll just kind of go along with it. Or if she comes across a point of information from other Duchenne's parents or through PPMD that there's a new medication out there that people are using, or the medication that was prescribed to me may not be the best choice, then I'll usually go back to the physician and say, probably not this medication, maybe this medication would be more suited given my condition. And as Ben mentioned about anxiety and depression, I've also incorporated that into my healthcare as well. So now I try to see a psychologist every so often to check in with my mood and perhaps prescribe some medication to help with that as well. It's not just physical, it's also an emotional thing too.
That's actually bringing up a great point. Have any of you also, and you don't have to disclose what it was for, but have any of you along the journey disclosed psychological support or counseling support? Any in the room want to? So, I mean, you just a simple yes if that applies to you.
Yes.
Yes. Others?
Yes.
I think, just broadly speaking, I think for any person, the ability to talk through issues with someone else can be cathartic, therapeutic, right? So I think when you add in essentially life-threatening issues, it's something that there should not be a stigma against it. And I think talking about it with any resource, including mental health professionals, is definitely the right approach.
Okay. So let's talk about emerging therapies. So as you look at the clinical trial pipeline and you're looking at the emerging therapies coming through the pipeline, and this is for everybody, all the guys and caregivers also of this age group, as you're looking at what's coming in terms of what physical gains, slight or significant, could be gained from these emerging therapies, what gives you pause? What grabs your attention right now from these emerging therapies?
Like specific drugs?
No, don't name the drugs. Just what are the, don't name that we're doing this non-product specific today, but what are the physical gains or, again, maintain function? We talked about some upper limb, but are there any other potential benefits from some of these therapies that you find just really interesting right now?
I think that a few therapies that are trying to target, because in the past decade, I noticed that there was a lot of funding for genetic therapies to target specific gene mutations that are leading to one's Duchenne's, or using a broad spectrum gene therapy to help target the exact source of the malfunctioning protein. But what I am most interested in now is because everyone has these emerging mutations that aren't exactly treatable, or that because Duchenne and Becker's are on technically a spectrum condition where any point of mutation on the dystrophin protein can lead to either Duchenne or Becker's or some form of that dystrophy. I think looking into the biochemical symptoms of that condition is the most intriguing, because not only is that poignant in maintaining skeletal muscle strength, but that's also poignant in maintaining cardiac as well as smooth muscle strength. So the smooth muscle of your digestive system, or the smooth muscle that's essentially all around your body that isn't connected to the skeleton, that you can't move on your own or is involuntary. You know, if you have bad digestion, or you have diaphragm issues because your smooth muscle is getting weak, then that's also impactful, because that can lead to everything else, like related to cardiac, pulmonary issues, and even digestive issues that can be life-threatening.
All right, that was a very good answer.
Yeah.
Anybody else? And this doesn't just have to be panel. Others in the room? Angela, and then we can do Brian.
Could I?
Yep, Colin, you can answer while Brian's getting to Angela.
I'd say I do agree with Jonathan that gene therapy is very promising, and that would be great. Just not only helping, I mean, like I said earlier, with my arm strength, but also maintaining heart and lung health, just stability in all the muscles. Is I mean, really something great. That would be great for this, for everyone with Duchenne.
Thanks, Colin. Angela?
Annie, I'm not going to answer your question. I apologize. I'm going to expand a little bit. So I'm Angela. I'm from Westminster, Colorado. I think we have got to start looking towards a cocktail. Where we sit right now, yes, I'd like Jack to have improved respiratory function and improved cardiac function, and I'd like him to not have, the effects of steroids, so I'd like a steroid alternative. I think the cocktail discussion has to start. If we do one area per generation, we're going to have a really big problem on our hand.
Yeah, that sort of lends itself to, we hear the term or the phrase in this community sometimes, one shot on goal. And I'd just be curious, and then we can open this up to others, does that statement resonate for anyone in this room, and what does that mean to people? I think of that when you talk about the need for a cocktail. So Brian, you can answer the question you were going to answer previously, but I just leave that lingering out there.
Sure. So in thinking of the therapies that are becoming more prevalent in terms of discussion within the community, I think the reality of restoring lost function is still very much in question. And I think that irrespective of where we are within the progression, each of us has come to a sort of homeostasis. We're comfortable with where we are. And in my opinion, I think that for just about any family, maintaining the level where we are right now is every bit as beneficial as anything that's being proposed. And I think that for a lot of us, that can be a shot on goal. When you stop the progression, no, it's not a cure, but that's a heck of a victory.
Mm-hmm. Terrific. Thanks, Brian. Julie is right here.
I just wanted to add.
Can you introduce yourself, Julie? Can you introduce yourself?
Oh, Julie Cosgrove Garcia, Sacramento, California. My son is 26 years old with Duchenne, Nicholas Garcia. I just want to add to compassionate use, because people, as we heard earlier, come so close to being part of a clinical trial, and then yet they come close, or they fall short, either because they're overqualified or underqualified. But to have that compassionate use, to allow the opportunity for each and every one, I just think it's important to find that so that families can experience that and contribute. And in the older ones, there's so much that they can offer too, as well, in terms of progression, if they're affected, or how well that drug works for them. For my son, at 26 years of age, for him to get into a clinical trial was significant. But that opportunity isn't out there for the older ones as much. And I think that consideration needs to be taken into account. When Nick was 1 month shy of turning 10, there was nothing hardly in the pipeline. We've got so much in the pipeline, and we should open it up for more. Thank you.
Great. Thanks, Julie.
Julie, thanks for saying that. That was one of the things I think we were talking about yesterday with one of the industry partners. We were saying, is there a way to, instead of having the age range, just having the criteria based on function?
Great. Okay, Amanda.
Yeah, so Amanda Becker from Massachusetts, mother of Jack, age 13, and the concept of the one shot on goal, it drives me crazy, I guess, because I feel like we're in a time where we should have better indicators for responders or non-responders. We do have a lot of therapies in development, and right now I don't feel like we have the tools to say which child might be responding well and which child might not be responding as well. And to Julie's point, my son has benefited from compassionate use for a heart problem that was unrelated to Duchenne very early on in life. So I feel like compassionate use should absolutely be put into the equation. And I also feel like some of our trials are very long, so we need tools to decide so that children aren't hanging out in a trial for 4 to 5 years without those indicators. Because we have obviously a lot of folks that are willing and able to explore new territories and new therapies.
Great, thank you. Anybody else want to speak to the themes that are emerging right now? Okay, so we're going to I'm going to ask each of these guys, but then any of the men who are in the room who want to answer this question to help us end this panel, I think it would be really great. So if you guys listen to the question so that when we get to you have an answer ready. I'm making eye contact so you look up from your phones. I'm sure you're looking at the polling from the day. I'm sure that's what's happening back there. But we've asked each of the polls or each of the panels to talk about what your hopeful about the future, what you're hopeful, optimistic about looking forward. And we've heard all of these men in the room got pulled away from school and work to be here with us. And so I'm just interested to hear from these gentlemen to end the day about, as you look to the future, what are you hopeful about? What are you looking forward to? What do you look to as you look to the future? We'll start with Ben.
Okay. For me, I think what I'm hopeful about is I've seen in the recent years a lot of work around creating resources that allow for better, like more independence, either that being financially or otherwise. But I'm hopeful that, like, going forward, there will be more resources that help enable us to continue working and contributing more and more. And I also think that I'm hopeful about the prospects of trials that will result in drugs that have some level of impact on either preserving function or slowing the decline or other benefits.
Super. Thank you, Ben. John?
I'm not really sure at the moment. There's so many things going on right now, and my current focus really isn't waiting on anything to be approved or waiting on these things to happen, because if you just sit and wait, then you're not going to go anywhere. So my hope is that I can still get where I need to go, whether or not I know where that is at this moment in life. So I'm hopeful that I can figure that out soon and be able to get there eventually without having to sit around and wait for it to happen.
Okay. Colin?
I would kind of echo what Ben was saying. As I mentioned earlier, hoping to get into, it would be great to get into a trial to help keep me stable. But additionally, I'm just look forward to continuing and being involved in the Duchenne community. Just it feels great to be making a difference. So.
Thank you, Colin. Mario?
So one thing I'm really hopeful about is when I see the young men sitting to my right and out there who are embarking or going to be embarking on a lot of the journey that I myself faced, and to see the intelligence and the optimism and the character that all of them display. As the old guy in the group, it's really gratifying to look around me and see that. So I have a lot of hope for this community because of them. On a personal note, I think really, as I alluded to before, I want to be around as long as I can with my wife and baby daughter. So my hope is that that will be many years, but I'm being realistic and looking at an ejection fraction of 25%, a forced vital capacity of 30%, and hoping that there will be solutions targeted in those areas that will either stop them from further decline, allow them to improve a little bit, with the end goal of prolonging life.
Great. Thanks, Mario. So others in the room want to answer? Michael, Austin, Patrick, anybody else want to answer? Austin has the mic.
Hi, this is Austin, and I would like to, some of the things I look forward to is, I'm very ambitious, but the top 3 that I really look forward to is learning more, or top 4 I would say, learning more about gene therapy and exon skipping. I hope to go to school for mechanical engineering. I want to do consulting and work in biotech, but mechanical engineering, the reason I want to do that is so I don't have to wait around for drugs, like to use technology to help me too. So, and then I can work around my disability whether or not I'm on these drugs that will help.
All right, that's a man with a plan. All right, Austin. And Michael?
Well, I also have multiple things I was thinking of. Well, the gene therapy, I'm hoping for that, but I'm going to be graduating in May, so with a physical disability, it's a big milestone to be able to graduate with a communication degree from university at UMass Boston, and also the internship I've been doing with Solid. Going to continue to be working there, so being able to work with them on the gene therapy and get to see the progress and everything with that is a really amazing opportunity. So that's another thing, basically what Austin was saying, try to continue and help with science, and even if you're not hands-on, but from a different perspective from the communication side of things. So keep looking forward to those things.
Great. Thanks, Michael. Patrick, do you want to say anything? No? Anybody, did I miss anybody else? Who wants to? Okay. So I'll end with a quote from somebody else who wasn't here with us, who talks about how at some point he's an adult with muscular dystrophy, who says that at some point he stopped worrying about his CK and opened a 401k. And so I think that really speaks to some of the issues that these men raise. So let's hear it for this panel. Thank you.